Hey there, I'm Justine Buick from the NCLEXtutor.com, where I help nursing students pass the NCLEX and their nursing exams through private tutoring. And so today I'm going to be talking about NCLEX Bootcamp. So this is the NCLEX prep resource that a lot of students are using, and I'm going to give you the pros, the cons, show you my scores, and then give you some tips if you do decide to use them. The reason I did this review is because lots of my students were coming to me and they were saying, oh, I'm doing boot camp, or I'm going to do boot camp. What do you think? And so I need to be familiar with all the big resources out there so that I have something to recommend to my students. Now, even though I did not get paid by anyone to do this review, I did ask boot camp if it was okay if I showed some of the questions and showed my dashboard, because I didn't want anybody coming after me for copyright problems. So I did get permission first. So boot camp was started by Dr. Ari Rezari. I hope I said his name right. He has a background in dentistry, and of course, he can't do the NCLEX nursing stuff, so they had to bring someone on. And so Dr. Emily Wilson is the co-creator of NCLEX Bootcamp. She features prominently throughout the course in the videos. Now, number one pro is it looks like the real NCLEX. And that's important because you want to be familiar with it. You want to make sure you see that blue screen and there's no surprises. Now, number two pro is the easy to use platform. It has the different questions, and you can break it up into the different types of questions that you want to do. If you want to go back and look at your previous tests and your scores, that's really easy to do. You can see what other students were getting in regards to their scores. And so it's very easy to use. Number three pro is has very well-written questions, and that is huge. I mean, that's what I look for the most. Are these questions well-written? Yes, they are. There's no typos, there's no formatting issues, they're not asking you about crazy, obscure things. The next pro is the rationales. They are so good. They give you the right answers and the rationales of why they're right, and then the incorrect answers, they give you the rationales of why those are incorrect. And they give pictures, a little short explanation, there might be a video in there. And so their rationales are just really well written, and they are not overwhelming at all. Another pro is they have 4 100 question readiness tests, and they include all the different sections of the test plan. They have the case studies, and these tests, which I did all 4 of them, are really good. I mean, they really represent kind of the basics that you would get asked about, and then they give you the chances of passing. So is it low, borderline, high, or very high? And they are not CAT exams where they're computer adaptive tests, which I think is fine. They don't need to be computer adaptive testing. You just need readiness tests to practice that look like the real NCLEX, and they are covering the basics, and they have those case studies. Now, there's a couple other pros that I think are good for students who I'm not tutoring. They're things that I would not personally use with my students, but they're good for you if you are not going to be getting a tutor. So they have a study plan. So you can kind of move it around, move topics around of what you want to do. I have my own personal study plans that I set up with students, so their study plan would not work for me. They also have video courses or video reviews of content, and it looks like they're adding them as they go along, and so that's really good for students because some people learn really well when someone is explaining the content to them. I personally would not use it with my students just because I have my own book, the NCLEX Nuggets, and I have videos that go along with it. And for me, it's much better for them to use my stuff because I can kind of control what they're watching and listening to, and making sure that they're not going to get overwhelmed with too many videos. And then another thing they have is their cheat sheets. And I actually counted how many there were. There's over 600 pages of cheat sheets. Some topics have, multiple pages. But to me, to read over 600 pages, I mean, I don't think so. I think it's good if you need to brush up on something because they are very nice looking. They have images and there's bullet points. So I do think they're good. There's just something that I would not use personally with my students because once again, my students are going to use the Nuggets book that I wrote, which is 200 pages and it's still kind of that bullet point format, but it has lots of images also for reviewing content. All right, now we're going to look at the cons and there's not very many. Number one con is you can't break the questions up on how you want to do them based on the NCLEX test plan. There's certain topics that you have to pass. There's 8 sections, traditional sections, and then there's the sections for the case studies. Some of my students, when they come to me who are repeating the test, they have this CPR report and tells them what sections they were below, near, or above passing. And they say, well, I just want to practice questions for a certain section of the test plan. And I said, well, you can't really do that in boot camp, at least not for every section. So they don't have physiological adaptation, reduction of risk potential, health promotion and maintenance. And that's kind of a bummer because I can kind of tell them what to practice, but not exactly in their Q bank. So if they could actually change that and give that option, that would be really amazing. Now, the second con is that, and I don't know if I'm being like nitpicky or maybe I'm just uninformed about maternity because I am not a maternity nurse, but I think their maternity questions are too hard. I mean, the target score is in the 40s, which is really low. I think I got in the 60s with my maternity questions. But I mean, come on, throw us a bone here. Like, give us some easier maternity questions because not every lady that goes into the hospital that's having a baby is having a complication. Like, most of the time, everything is just fine. So give us some more easier, everything is okay types of maternity questions. And then the third con, which this is not something that happens all the time, but there are some questions that I did not think there were written as well. And the answer choices I totally disagreed with, but I wasn't going to argue with the people at boot camp, even though I did email them and voice my concerns a little bit, and they did explain why they were the correct answers. I still totally disagreed with them. Only because I've practiced so many questions and I kind of know how questions should be written and how the answers should be presented. So there was just a few of them that happened with, but I want you to know that whatever resource you use, you're always going to find problems with some of the practice questions. Okay, so now I'm going to show you my scores. So I click on performance here and you can see that my overall score is 77% and the target was 61. So I'm guessing that's the average or at least a little bit above the average. And as you go through each of my subjects, you can see that adult health, I was 80%. So the target over here is 57%. So I was much higher. Child health is 78%. Fundamentals was 82%. Maternity and newborn, you can see I did not do great, is 64%, but the target is 43%. I mean, I don't think so. Let's get the target numbers. I feel like should definitely be higher. You don't want to only be getting in the 40s and the 50s. I'm going to say you want scores that are definitely higher than the target. Mental health was 81%. Pharmacology is 78%, and then management of care, my top performing subject area was 83%. Those include a lot of the who do you see first types of questions and what do you do first. So I've gotten pretty good at those over the years. I want to say though, 77%, you might be thinking, what? Why is she not getting like up in the 80s and the 90s? Well, I don't know everything, so I am going to miss some questions. I also get careless at times and I go too fast and I pick the wrong answers, like I'll pick the opposite answers sometimes, or I just totally missed something in the question, which I know not to do that, but sometimes I still do it. And then also, I just disagreed with some of the answers, so no matter what, I'm just going to get it wrong. And then when I click on my readiness exams here, you can see I did all 4 of them, and I got very high chance of passing for each one. And these exams were really good. Like, I thought they were really fair. Now, if you do decide to use a boot camp, I do have some tips, and you can use these tips with really any resource that you're using. But my number 1 tip would be review content before you do the questions. Because if you're doing questions, say like for cardiac, and you're going, oh wow, I don't really know this disease. I'm not really sure what this EKG strip is, or man, I have no idea what these meds are for. Well, you should have reviewed some content beforehand. And I always think it's really important that you do some kind of content review before you start a bunch of questions. So even in school, they'll do content review course types of things, you know, the last week that you've graduated. So even if you do that, that's good. Sometimes some people need something a little bit more organized. So there are content review courses out there. This is not a video where I'm comparing courses or anything like that, but there are some good ones out there. There's Hearst Review, Remar Review, Marklemic Review, and even with my students, I use my Nugget pages. I have a review with the videos. And so, you know, do something where you're doing a content review beforehand. And even boot camp has all their cheat sheets and they're putting their videos up. So if you did feel like you needed to review something, definitely do it. Now, when I do questions, or I have my students do questions, I always tell them, let's just focus on one topic. Let's not try to do everything because you're going to get overwhelmed. So I would suggest that to you too. When you go in and you start your questions, just start with one topic. So just management of care, just cardiac, just endocrine, just maternity, whatever it is, just start on something so that it makes it more manageable, and then you can actually review the content afterwards. Once you've gone through all your topics and you've done questions for everything, then you can just do what's left over and kind of just do a variety of questions and then do those readiness tests. All right, my 3rd tip is very important. And when you get a question wrong, you need to review the rationale. Don't just read over it and go, oh, okay, well, I got it wrong. Oh, there it is. I highly, highly suggest that you write the content down that you got wrong. So I use a spreadsheet, and I'm going to show that to you right now. Okay, so for example, I have some tabs down here of all my different topics. I just use Google Sheets, and you can see I have meds. So I just put in what it was that the question was asking about. It was asking about a kid refusing medications, and then I picked some wrong answer. I don't even know what the wrong answer was, or maybe this was a select all that apply. But anyway, I missed this answer. Ask the pharmacist to add a flavored syrup to the medication. Okay, fine. So I messed that up. I put that down in my content review. And if I go over to adult health, you can see that I always put in first whatever the main problem was of the question. So they were talking about migraines in this question, and apparently I missed an answer that says migraines, one of the symptoms is they get nausea and vomiting. I have no idea how I missed that because I definitely know that. But just because I think I know that, I am still going to write it out because I do not want to forget that. I do not want to mess that one up again. And then my last tip would be just finish all your questions. Bootcamp has around 2,000. That's a really good number. It gives you lots of practice with the different types of questions and exposure to all the different types of topics that you might get asked about. It does not cover everything. That's why I say still do a content review, okay? But 2,000 is a really good number of questions to do. So just do them all. Now, can I recommend Bootcamp as a study resource? Absolutely, absolutely. Use Bootcamp for your practice questions for your Q bank. If you need to review some content, they have that there too. They just have a bunch of different resources to help you, and I can definitely feel comfortable recommending it to my students. Well, thank you so much for watching. If you are interested in private tutoring, you can go to my website, thenclextutor.com. If you like this video, if you want me to do more reviews, just put in a comment, let me know. And thank you so much for watching. Bye.